Okay, so that's me on the slide there. So first thing I want to talk about is what myasthenia gravis is. And myasthenia gravis is an autoimmune disease. And although this is fuzzy, and this came from the New England Journal of Medicine back from 2014, they did a summary article on the latest studies, et cetera, on myasthenia gravis. And here to the left, you can see that you have these channels where the acetylcholine esterase receptors are. And normally vesicles that have the neurotransmitters or the chemicals that communicate between the nerve axon, this is a nerve cell here, and the muscle. So this is called the neuromuscular junction. This whole complex is called the neuromuscular junction because it's where the nerve meets the muscle. And these receptors in here are what are affected in myasthenia gravis. And what happens is the body will make antibodies to these receptors. Now, what you should understand is that with autoimmune disease in general, I think that a lot of people have been convinced by conventional medicine that they have antibodies only to whatever their identified disease is. For instance, with MS, they have antibodies to the myelin sheath that covers the nerve cells in the brain and the spinal cord. And many people are convinced that those are the only antibodies they have and they don't really have to worry about any other antibodies. Well, that is not true. And there are companies that do testing outside of conventional medicine, like Cyrex, C-Y-R-E-X labs, and they look at a number of antibodies in different systems. And they're, I would say one that's consistent is that people usually have gut, some type of digestive system antibodies when they have antibodies to the nervous system or antibodies to the neuromuscular junction. So, and you all can ask me questions about that later. Gut-brain connection, there's a gut immune connection. There are books out now about the gut-brain connection that I've been talking about for 15 years. So myasthenia gravis, you can see here that these channels are atrophied because they're antibodies. All right, I flipped a little bit too fast, but what I want you to see here is that there's an association between fatigue, which is what we're talking about today as far as myasthenia gravis goes, and the adrenals and adrenal fatigue. So, you could have fatigue from this situation because your muscles are going to be weak, you're not going to have good endurance of the muscles. And then you could also, because of autoimmune disease mechanisms, you can have problems with your adrenal glands making cortisol, which will cause you to feel fatigued. So there are many, many case studies where in conventional medicine where they looked at the cause of the fatigue and found that people that had myasthenia gravis had both adrenal fatigue and they had neuromuscular junction fatigue. And when we talk about fatigue in the adrenal glands, we are not talking about Addison's disease, which is when your adrenal glands are not making any cortisol. And we are not talking about Cushing's disease, where the body is not making, or the body is making way too much cortisol in response to stress. And it's very, very high, and that causes high blood pressure and other problems. So this is kind of an in-between situation where the adrenals just are not working on the circadian rhythm. They're not working in the way that they normally do. And so people may feel tired. So we're talking about some of the symptoms of myasthenia, and people can have reduced muscle strength. They can have reduced endurance, fatigue, as I mentioned. They may have weakness in the muscles of the face, head, and neck. And they may have weakness in muscles in the arms and legs as well, or later on. So we are going to, in our next talk, we're going to cover some of this other information about the therapies, etc. And right now, we had a number of people join us on Instagram. And unfortunately, that recording, well, unfortunately, people are not able to verbally respond on Instagram. So I told people to do some homework, and the homework that I wanted people to do was to look at their activities and to make a comment in my DMs on Instagram about if they have noticed that certain activities may make them feel energized, and if there are certain activities that seem to take away their energy. And the reason why we're asking this is because a lot of times when people have myasthenia gravis, this may become very confusing because things that they were able to do yesterday, they may not be able to do today. Their energy can really fluctuate from day to day. And it seems to them to be rather unpredictable, but it can be influenced by systemic inflammation, by insulin resistance. It can be influenced by inflammatory elements that are affecting the sleep, that are affecting, it could be influenced by stress. It could be the type of exercise they're doing. It could be the types of foods that they're eating that can contribute to that as well and make it worse. So, and that's with any autoimmune disease, but especially concerning when we're talking about energy, like in this case. So, all right, I'm gonna see you guys back on tomorrow at 6:30 p.m. And we are going to continue talking tomorrow. Thanks for coming by.